It was early on a Thursday morning. Freddie Martin's wife Susan had gone to bed with shoulder pain the night before.
I hear the alarm go off, and all of a sudden I hear boom.
Experienced cardiac arrest. Without the network, she probably would have died.
She's laying in her small, where the toilet is, in the floor. And I'm like, Susan, Susan. She's not responding, so I go in, and she's laying facing the wall from me, and I roll her over. I immediately pull her out into the main bathroom, and I realize there's something going on here. I run in here. I call 911. They asked me, is she breathing? And I said, no, she is totally not breathing at all. They said, well, go unlock the front door. I go unlock the front door, and they said, go back in there, do you know CPR? I said, no, do not. And they were getting ready to walk me through how to do CPR. And at that time, in between to there, to there, to there, to here, to back, the local fire people at the end of our street were here and coming through the door.
Susan had not only had a heart attack, but she was in full cardiac arrest. Fortunately, the fire station was just a block away.
She did not look good, and after our assessment, there was no pulse. She was not breathing. We initiated CPR. We got the pads on. The AED did say shock advised, so we began the shocks. After, and I don't know if it was several shocks or one. She would come back momentarily, and then you would lose her again, and it would give you the shock advised. So we continued to shock her until the paramedics arrived.
Been through several calls where it was a cardiac arrest, but to be so young and not be a trauma related, I don't know that I've seen that before, and I've been doing this like 14 years. So it might be the first that I've seen it in someone this young.
Susan was transported to Williamson Medical Center, a certified chest pain center and a member of the St. Thomas Chest Pain Network.
She basically presented in near full arrest when she actually arrived in the emergency room, so she immediately had to be intubated, and routine CPR type activity actually took place with her. Well, they immediately called the cath lab, and at the time she arrived, we actually were already here with a patient on the table, but we were able to assess her, get stat laboratory, because it wasn't entirely clear what was going on with this young woman. She's not in the peak heart attack age range, really. So we assessed the lady while we got the other patient completed and off the table, and we're able to move her immediately to the cardiac catheterization lab. We found that she had totally occluded left anterior descending, the artery on the front of her heart, and we're able to open that with some stents. It was sort of a small artery, which made it more difficult, but we had a good door-to-balloon time despite the fact that she presented in full arrest. She remained hypotensive, so we put an intra-aortic balloon pump in to support her blood pressure and support her perfusion to her heart, and we're able to transfer her then to Baptist Hospital, which is part of the St. Thomas network, for more advanced care that she obviously was going to need.
When a patient first comes in, as she did after the heart attack, you want to see if there's going to be any recovery of the myocardium at all. And so, although you're thinking about the transplant and you're working them up, you're still working towards recovering the heart. And we were fortunate enough that we were able to pull her balloon pump within about 4 to 5 days after she was first admitted to us.
It was hard to believe because, I didn't have any of the classic cholesterol, high blood pressure, overweight, smoking, none of the classic symptoms that sometimes go along with heart attack and cardiac arrest, so I was pretty shocked.
But she did have symptoms.
Everybody tells me I did. I talked about my shoulder. I really don't remember that week.
Susan spent 31 days at Baptist, slowly recovering. She has some advice for other women.
Oh gosh, listen to your body. I mean, everybody says that, but I guess we have our pain for heart attack and cardiac arrest sometimes differently than the normal chest pain and in different places. And just because it's in your arm or maybe your back or wherever it is, get it checked out. can't be too frivolous, I don't think.
The odds are if they had not gotten to her faster, she would not be here. The vast majority of people who experience cardiac arrest out of the hospital never make it into the hospital, simply because it either wasn't recognized or they were in a position where life-saving therapy couldn't be delivered. It's estimated that half of all the people who have their first heart attacks will die from this arrhythmia before they ever make it to the hospital. Warning signs are often overlooked. Patients sit there and say, well, I'm too young, or I'm a woman, or I exercise a lot, how could I be really having warning signs? It is easier to listen to the warning signs, to get it checked out, and then feel better that everything is normal and that it's not from your heart, than to assume that it's not from your heart and avoid it and avoid it and avoid it until one day you may not get that second chance.
I think having a relationship with Williamson Medical Center is very vital in that our communications are crystal clear. We are trained together, we work together, so when we're at the scene, it's just like the physician is there. We're working under protocols that are established by our medical director, who's the same medical director for the emergency department here.
Once in a great while, you make a difference. So I guess that was once in a great while. You contact people every day, and then you're not around them very long, and you give them the best care that you can, no matter who they are or what's going on. A lot of times it's some little something that helped me out, hurt my little thing, and you take care of them, and they feel better, and you get them to the hospital, and they'll thank you, and that, we appreciate that. And then sometimes it's something more. It can be a bad injury, a bad illness, and then in this case, an arrest. So then, you know, maybe we made a difference that time. And that's one of those times. Okay, we did all right.
We're here to help people, and you know, you don't get many occasions to actually, you know, have a successful resuscitation. So to play a part in that, you know, makes you feel good.
I'm very pleased. I mean, it's a wonderful network that you all have.